Greetings and welcome to the International Pediatric Simulation Society podcast. This show is for people passionate about pediatric simulation-based education, training, and research. Podcast hosts are members of IPSS, a global community of multidisciplinary healthcare professionals from over 30 countries, all dedicated to improving the care of infants and children worldwide. Each week, one of our sub-hosts, Christine Bailey, Elaine Ng, Aaron Karn-Bennett, and myself, Samreen Vora, will introduce you to a new guest and bring you into a conversation with simulationists and healthcare professionals from across the world. Come along. On this episode of IPSS the podcast, we have Peter Dieckmann, an associate professor for work and organizational psychology with the Danish Technical University and chair of the board of the USIM group, joining us. For the last 25 years, Peter worked with simulation in healthcare for basic education, continuous training, development, and research. He is interested in using simulation to optimize the interplay between human beings, technologies, and organizations in the interest of patient safety, quality, efficiency, and the well-being of workers. He has a particular interest in including those people who are, for whatever reason, considered to be at the edges of social practices. He believes that inclusiveness of diversity is not only the morally right thing to do, but also helps in dealing with the complexities of the world. Peter is past president of the Society in Europe for Simulation Applied to Medicine, CSAM, an invited inaugural fellow of the Academy of the Society for Simulation in Healthcare, SSH, and associate editor of Advances in Simulation. He published more than 100 peer-reviewed journal articles, 50 book chapters, and 4 books. He is a renowned keynote speaker and workshop conductor around the world. Hello, Dr. Dieckmann. I am so excited to have you on our IPSS, the podcast, to talk about the work you've been doing and specifically focus on faculty development and your expertise in that area. Welcome to our podcast.
Thank you very much. It's great to be here and have the chance to talk with you. I'm very excited.
Yeah, I am too. As we were prepping for this podcast, I mentioned to you, I still remember both of us were keynote speakers a number of years ago at the same IPSS conference. And so we had some intersections of interest in simulation, DEI work, a number of other things. It's exciting to actually have a one-on-one conversation with you because I don't think we've had that before. Let's dive in. I mentioned that you have particular interest in faculty development as it relates to simulation education. I wonder if you could just give us a little bit of background in your experience and how you came to this space.
Yeah, thank you. So I originally was asked when I started to work with simulation, people said, hey, you're a psychologist, you have to look at our debriefings, they're difficult and so on, and we want your input. And then I looked at this and at the debriefings and saw that, the facilitators have such a big influence on the whole debriefing, and then kind of developed the idea that the simulation setting around the debriefing is important. It's not only the debriefing conversation, but also how you set the scene. That kind of naturally brought me into thinking about, how would we actually help people to perform well in this simulation setting? How do they set the scene? How they conduct the debriefing and so on? And then we started to develop a course for this when I was still in Germany, and we were running facilitator courses. And then we kind of got together with a small group in the beginning that then grew into the USIM group. It's a network of people and organizations providing facilitator courses, and I'm the chair of the board of this association. So I'm very much interested, in how we can actually help people to run good simulations. What I think is important is if you do a lecture and it's boring, nobody will get hurt by this, they fall asleep anyway. If you do a bad simulation, you actually can hurt people. I've seen many very experienced clinicians who had a simulation 3 years back, and when they talk about this simulation, they still had tears in their eyes. I was treated unfairly, I felt horrible, and so on. And my motivation is, to help people to run simulations that actually make a positive impact on people. That does not mean they can also cry, but they have to cry for the right reasons. And getting like potentially really moving insights, and that is why we need good facilitators.
I love that you started there. I tell people, so, I'm very embedded in simulation now, but when I tell people and they're very surprised, they'll say, I hated simulation as a learner. So when I was an emergency medicine resident, it was early, it was many years ago, I won't say how many, but I think, a lot of the things we now know about psychological safety weren't quite being embedded. So in the way our facilitators, and not to ding them, I think it was amazing, it was a great form of learning, but I had so much anxiety and I really did not like it. And the tears that you mentioned, different kind of tears. You want them to have some emotion in sim so they retain knowledge, but not the kind where years later I still vividly remember one of my simulations where there's all these people watching and I just wasn't getting the thing they specifically wanted me to get. And that kind of trauma and tears is not what we want. That doesn't facilitate feeling good about something or even the learning that we're aiming for. And the other piece, your background as a psychologist, sounds like that's where it all started, which is so different than me and many other simulationists that have this coming in from this clinical background. That's our frame, and we're like, okay, these are the things we got to get people to learn in this simulation. But understanding all of those underlying dynamics and emotions and how they all interweave, I think having your background as a psychologist so powerful. That distinctness, the things that you could see that a number of other simulationists, as they looked at the facilitation, potentially couldn't. As you mentioned USIM and the facilitator courses you were developing, what was unique, and then how did you embed that into the trainings that you do for facilitators?
So as a psychologist, I think what I'm trained into is try to understand the experiences and the actions of people without as much as we can, without judging them in the first place. And I think that is a mindset that is maybe helpful sometimes where within the healthcare professionals, you by the nature of your task, you need to kind of understand very quickly, is this good or bad? Do I need to do something? So very action oriented and so on. And I think what we can bring in as psychologists to kind of slow down this a little bit and kind of interpret the situation maybe from a little bit more abstract angle as well. So I always, say we come with our models that you guys find a little bit abstract, and you come with your stories that I find a little bit boring, because I want to get the essence out of this. Yeah. And I think this interplay also kind of between our different professions is really beneficial. That we combine the more model abstract thinking of psychologists, trying to separate the analysis from the action. And then combining that with the healthcare professional solution orientation that get things fixed and so on. I think that was interesting. What I also want to say is psychology has also sub-branches. Like you emergency medicine, you think different from a psychiatrist, from a pediatrician, from internalist and so on. And also within psychology, there's different areas, and I focused on work and organizational psychology, not clinical psychology. And I think in the context of simulation, what's very important here is that I'm very sensitive to mixed messages. So in your procedures, somebody tells you to go left. In the training, they tell you go right. And nobody picks up on that. What you hear from different places is different messages. And I think this dimension of work and organizational psychology, we are interested in this interplay between human technology and organization. And I think also when we look into newer developments of simulation, the whole notion of translational, transformative simulation, in supplement to the individualized teaching and learning situation, I think is a super interesting area.
That is everything you said, so fascinating, particularly in simulation. These mixed messages, it makes me think of, in medical education, the hidden curriculum. So where they come in, they learn something in simulation or in training, and then they go out and see in practice that that's not what's being done. And it can be, you mentioned the example of procedurally, but I've also seen it in communication, in interprofessional teams, what's expected and how things go, where how they are in simulation, they're trained a certain way, and then you go out and practice and you're like, oh, there's some different expectations or hierarchies here. So those mixed messages, do we even address them, or and how do we potentially try to resolve them, I think is very interesting. And in your training for facilitators, do you get down to that level of discussion as you're training folks to run simulations, to how do you address things that might be what you would call maybe mixed messages, what I would think of as hidden curriculum that they might encounter post-simulation and such?
We have different courses. So in our level 1 course, it's more about getting the techniques and, kind of what is an open question, what is a closed question, and, wait a moment after you have asked a question to actually listen. It's more about the techniques and helping people to get going at all. Then in our level 2 course, we would go more into also this notion of what type of simulations should you design, where do you put your energy, and so on. In more general terms, and I think that is something that we also still developing in the USIM group, but I think it's very important that we start to think about more, what do we use our simulations for? So I think in many facilitator courses and workshops, there's many really good groups around the world providing this. But I think most of us, we focus quite a bit on how do you do simulation well. Having good scenarios, having good debriefings, and so on. We discuss that. What I become increasingly interested in is this notion of what do we use our precious resources for. And I think this is a matter of political decisions within the field. You have people who say, what is the situations that you need to train in emergency medicine, for example. There is, experiences with this, the stuff that you see very often or not so often, the stuff that is really sensitive that you should get it right, and so on. So there's a lot of logic from out of the field. What is the stuff that you should train? But I think there is also different sources of guidance that we could tap into when we think about what should we actually use our simulations for. And I think that brings me to also an ethical perspective, a moral perspective. I'm actually working on a paper with a colleague from Argentina, Cecilia Cantón, and she teaches ethics in medicine in Argentina. And she brought up this notion that it's actually a moral choice of what type of simulations you are running. And I think the choices that we make when we think about which scenarios, which scenarios you run, which debriefing topics that we focus on, is also an expression of hidden or not so hidden power structures, traditions. Majorities define what is the important thing here to do. And if you're a minority, well, then go somewhere else. It's not our topic right now. And I think I'm very interested in people that I call being on the edge of social practices. So you're part of a hospital, but you're slightly off center for whatever reason. Might be your belief, might be your clothes, your identity, thousands of different reasons where we include and exclude people. And I'm very interested in, how would simulations look like if we at least occasionally also take the people on the edges of social practice into account. I mean, we cannot always do this. There's a reason why majorities and so on also make sense. But occasionally we can think maybe differently.
That is fascinating. I think you're 100% right. The majority controls. And so when you think about simulation and particularly, so my view, the other piece of our conversation that's really fascinating to me is it's very international, this conversation. Even where you are, you're collaborating with someone in Argentina. My frame is from the U.S. and how all of our political factors play into what we do, and also how our structures of our simulation centers, where they sit, are then influenced by those higher structures. So I think in the U.S., my frame is a lot of sim centers, they're in academic centers, if they're in hospitals or within organizations where you have this influence of what can and can't they do. within their simulations that impacts if they can get to this piece that you're talking about. How do we bring in those that might be on the edges of social practice, and bring those pieces into what we do in simulation when we're making decisions about what are we going to focus on. I wonder if we could speak a little bit, and maybe some of this might be controversial, particularly because I think our political climate's definitely in the U.S., but around the world right now is so hot. How do you take that into account as you're writing this paper with your colleague and you're thinking about these pieces? It's from above and, but right, you're talking about the two ends. You're talking about from the hierarchy of like what you're getting told, what you can and can't do potentially, and also then incorporating folks that might be coming from the ground, right, grassroots. How do you balance that, and how do you think about that?
See, looking at the political landscape around the world, in the US, but also other countries, I disagree with many of the developments that are there. Let's leave it like this. What I do recognize is that I myself getting a little bit closer to the role of an activist in addition to being a scientist. So what I said with a moral choice around what we run our simulation scenarios for, I think it's also a moral choice. What do we do research on? I think it's nothing is a politics free room, and I recognize that I get more also in this direction. Together with my colleague from Canada, Latika, I'm editing a section for advances in simulation where we look into equity, diversity, accessibility, and inclusivity. And within the context of this, there were actually discussions, where people got into trouble in bringing up the topics. In some countries, some of the terms that I just mentioned would not be allowed anymore.
Yep.
You would actually get into trouble with this. And again, I think, with this moral dimension that I mentioned earlier, I think it's about time that we take a stance. Do we agree with these new standards, or how much do we comply with them? And I think that is, again, the moral choice that we would need to make as individuals, as teams, and so on. And it's difficult.
It's very difficult because it ties into all aspects of who we are. When we talk about in simulation, we bring our whole selves and all of our identities. We think about our whole selves means that when you're making those decisions, it impacts your career. It impacts where you stand within an organization, what the repercussions might be based on what country you're in. Like you mentioned, those terms are dangerous at this point to use at times. So when I am making that choice and developing simulations, or where are we going to focus, what are we going to teach, having to think about that and make those decisions, I appreciate you saying we have to push on those edges, because as simulationists and healthcare professionals, that is the space we have to be in to make impact. And I do think simulation offers a space, and as you think about specifically faculty development, that's an area that I did a lot of work. My colleague Brittany Dallin and I have Shifting Frames Consulting, and we work with organizations to help them look at the outcomes. It's a moral choice to say, I'm still going to do this work, but then do it in a way that let's look at what matters to other folks, and how can we then refocus it on outcomes, patient experience. So still make that choice, like you're saying, to say, this is where I'm going to focus my research or my work in simulation, and how can I tie it to things, and how can I do it safely, is I think where it's challenging, depending on where you're at and what factors are influencing you. And it sounds like even as a journal, I mean, your role as a section editor, as you're making those decisions, I think your journal maybe has a little more flexibility, whereas there are a number of journals that won't publish. I've had a number of folks come back and say, well, they won't publish if you're using these terms. And so it's really interesting, the space that we're in, to say, yes, we have a moral choice to make, but all the things that are impacting that choice that we're making as simulationists it's challenging. It's not easy.
Yeah. And I agree with the moral perspective. If I tie this to the outcome perspective, I think there's also an argument for this. My basic assumption is we live in a world that is so complex that nobody understands it anyway.
Yeah.
Show me one person who understands your emergency care unit. Nobody understands even this. The hospital, a country, the world, nobody understands it. We live with the illusion that we have some kind of understanding and so on.
True.
From this argument, my basic assumption is that if we have more and different perspective on the world, by default, almost like a gene pool. The more diverse that is, the better the chances are to adapt to a changing the environment. There's one thing that is constant in our world, that it's constantly changing. And whenever we kind of fix on a solution too much, that might be good for now, it might be good next week, but in 5 years, the world has developed and we cannot prevent that. And then our solution is outdated and we maybe are stuck on this. So I think besides all the moral dimension that we could debate, what is the right thing to do? I think there is good arguments that if you want to survive as a species, if you want to push your treatment options, develop your field, and so on, I think more perspectives is better by default.
I agree with you, right? One of my professors a very long time ago would say, the eyes can't see what the mind doesn't know. And if you think about that, I mean, they said it from an individual perspective, but if you think from a group perspective, that's what you're saying, right? So if you have a group of folks that something is not in their frame of mind or knowledge because they don't hold that diverse perspective in that area or an identity that would allow them to have that kind of perspective, it's just going to be missed. And so on a group level, to have folks that have broader perspectives, more diverse perspectives, and can keep up with the very rapidly and constantly changing environments and things that we're working in and on. And simulation really should be a space that's what we're doing. We should be at that forefront of keeping up with that and providing a space where innovative and creative solutions can be created and then implemented rapidly and tested rapidly. Tying it back to faculty development, how do you prepare your faculty for something like that? How do you prepare them for that kind of flexibility?
I like to often, use metaphor analogies is the English word, that is a little bit outside of the context that we actually work in. If you allow me, I would test one.
Yeah, please.
With you. So if you think about the lines in front of washrooms, you say washrooms, I may not say toilet, right?
Yes.
Washrooms. Typically, imagine airport or a concert. The line in front of the female washroom is much longer than the line in front of the male washrooms. Why is that? You could ask, females often wear more layers of clothing. It's maybe more complex to take them on. You might have people putting on makeup. If you're in any kind of public space, it might be a space where you get a little moment from approaches that you get from the guys out there, and you take a little rest from that.
Yeah.
You might have conversations around this. Interestingly, when you look into the science, females wash their hands longer and more.
Oh, fascinating. Good for us. No, I'm just...
yeah, exactly. So, yeah, let's not go down that route too much.
Yeah.
So, you could say, from a behavioral perspective, if you learn to put on your clothes faster, do your makeup, don't talk that much, the line would be shorter. Would be a matter of, training you to be faster. If you take a more structural perspective, you see that typically the space that is provided for male and female washrooms are the same, square meter wise. That gives you 3 cubicles in the ladies' room, 2 cubicles for the men, and 4 places, urinal places. So by default, you have a higher capacity in the male room. You have 6 spaces compared to 3. The washroom, the hand washing thing, you can save one of the sinks anyway. So if you take this structural perspective, you suddenly see that providing the same square footage to both genders would actually create an unfair situation because, of the reasons that I mentioned. You could also ask, I think it's an important perspective, what do you do with people who don't want to pick one of those sides? But that's probably what we may not discuss here. I think very important, but I parked that for a moment. But if you put this together, you could look into, so who makes the rules about how washrooms are built? That is very likely middle-aged white men. And if you kind of open the perspective up to this and trying to convince them that they should build 2 2/3 of the space that they have for female washrooms and only 1/3 for the male washroom. Good luck in convincing them. And I think, this in my mind, if we have an analogy like this, a metaphor, then we can ask, okay, where in your system is the people who guard the fair solution as opposed to an equitable solution, for example. And that is one of the methods that I try to use, by picking these pretty drastic extreme examples to make a point and then try to link back. Where do you find that in your own simulation practice, for example?
What an example, right? To push people to think outside the box and think about the structures and think about where are the guards that you maybe didn't even realize were there. So again, if you didn't think about it, you wouldn't think to say, oh, how can I get beyond who's guarding these things and how can I get beyond that? As a simulation facilitator, you have choice in certain areas to say, well, where am I going to focus this debrief? What's important in this simulation? And it has to flex as well. It has to flex based on who your learners are, what space you're in. You kind of mentioned some of this at the beginning too, in terms of your environments. And you as a facilitator have autonomy in that space. And that's where your own identities and you being able to make a moral choice about where you're going to guide some of the debrief could potentially come in. I think the other bigger piece you meant in that example, though, is about the systems that you may not necessarily have control over, but you can never even get to seeing them if you don't recognize they exist and be able to step back and see that bigger picture. And you can't even see the influence of them on your simulations and you as a simulationist unless you take that step back. And so I love that you mentioned in your training courses, you take that step back, give that type of analogy, and then try to say, okay, how does this apply in your space and in your world as a simulationist? That's very powerful. It's very powerful. Yeah. Is there anything else as we're wrapping up? I know this was a short discussion. I feel like you and I could continue this discussion for many hours. Is there anything that you feel like we haven't touched on that we should talk about?
Yeah, I would like to raise one more point, and that goes to the notion of needs analysis. So again, also when we design our scenarios, I made the point, look at the edges of the simulation practice in terms of people. But no matter which participant we look at, I think it's also important that we understand in more detail what they actually do and what they struggle with in relation to keeping themselves safe and sound while being healthcare professionals. I think it's an important dimension, but also when they interact with patients. And I have the feeling that we sometimes get carried away with the subject matter, all the heavy stuff, heavy book stuff, what is the key issues of emergency medicine, being really good in making the finest differential diagnostics, knowing the newest treatments and so on. All of this is super important. But when you look also into the literature of all the challenges with addiction, suicide amongst healthcare professionals, I think we miss an important point. I would say healthcare profession works under two givens. You have to make big decisions under uncertainty, and you are dealing with emotionally challenging situations. As far as the people answered my questions that I asked so far, very, very, very few get any kind of systematic training in this. And I think we would have such a brilliant possibility with our simulations to also pick up on this, where the learning goal is, how do you as a person find your individual way of coping with the pressure that you made big decisions under uncertainties? Most of them were good, but some you also screwed up and maybe actually somebody got harmed. How do you find your way in integrating this into your life? Where do you find the meaning around this and so on? Then probably really also the psychological side of this. I think it's important that we also use our simulations to occasionally set the focus on, today you as healthcare professional are in the focus. It's not how you perform, but you as a person, how you fill your role with as much joy as you can in a whole lifetime, and don't have to struggle through the next day by drinking too much Chardonnay or taking some of the stuff that you should give your patients.
Well, you hit something on the head that is just so beautiful in our current times. refocusing all of us back on our humanity and the humans is where, right, we've become, I think, a little sidetracked from all of that, even as simulationists, even as we go in, particularly as facilitators or faculty that are leading simulation, remembering to refocus on the humans that are in the spaces with us. Yeah. No, that's really beautiful. I love that. I'm glad that we talked about that too. Well, this has been a lovely conversation. I feel like we will maybe in the future have you back on and continue talking about this topic, which is just so hot right now. And I look forward to reading more of your work and continuing some collaborations with you. Thank you for joining us today.
Thank you so much. It was really nice to talk to you.
Thank you for listening to this episode of the IPSS podcast. A special thanks to our behind-the-scenes producer, the talented Danish Kumar, and to the Starship Foundation for providing the equipment that makes this podcast possible. Join us next time.